Any of New Jersey's top policy leaders met to discuss the attempted conversion of Horizon Blue Cross Blue Shield of New Jersey from a not-for-profit health insurer to a for-profit corporation. Experienced conversion experts from around the country address New Jersey's leaders on a span of issues they must consider during the conversion process.
When we talk about conversions, what we're really talking about colloquially is the movement of assets from the nonprofit sector to the for-profit sector. You have an existing business entity. It operates as a nonprofit corporation. Doesn't have shareholders. It's not owned in the common context. So that's why we use the trust analogy. We have this entity. It has great value. Who owns those assets? Well, the answer is if we use the trust analogy, the corporation holds the assets, but it holds them for the benefits of the charitable beneficiaries, which in this case is the public at large.
The threshold question is whether the proposed conversion is in the public interest. It's not in the public interest, it shouldn't be permitted. And the way that you're going to determine it's in the public interest is you're going to look at both what happens to health insurance after the conversion. Do premiums go up? Do they go down? Do they stay the same? Does coverage shrink for certain populations? And then you're also going to look at what are the potential benefits of having a statewide healthcare foundation with, $2, $3, $4 billion in it. What could that do for New Jersey?
Some people have this misconception that for-profit companies behave very differently. I don't know, they're evil or something. And if that's what you believe, then I think you're going to assume there's going to be a lot bigger and worse impacts of conversion than I think reality would suggest. By law, a for-profit organization is required to maximize returns for the owners of the company, the stockholders. And if they don't do that, they can be sued, okay? So that, they have literally a legal obligation to do that. A not-for-profit company has a more amorphous mission. That is, it becomes whatever the board for that company decides it should be.
The question is, what really is the difference between the way the not-for-profit insurance companies and the for-profit insurance companies act? We assume that because their ownership is different, that they will act differently. But there's lots of evidence that there are probably people right now today watching this who are going to hospitals that are owned by for-profit companies and don't even know it. It's not clear that there's an awful lot of difference in the way they act. Now, not everybody would agree with that, but I think the question would be, well, what would you think would be the advantage of them continuing to be a not-for-profit? And then you got to weigh that against the advantage of having this independent resource and having them pay more taxes, which after all go towards some of the kinds of needs that all the citizens in New Jersey have.
Consumers, when they go to see a physician or visit a hospital, they trust that that institution is going to keep their best interests foremost in mind. When financial incentives enter the picture, they can sometimes skew the type of service that's going to be provided in that institution. But a lot of points were raised here today is it's not necessarily a slam dunk either way, because nonprofits don't pay taxes. There are many nonprofit insurers that don't provide much care to low-income people. So it's kind of a mixed bag. You have to look at each specific institution and find out whether it's really living up to its nonprofit mission or not.
Day to day for a member of Horizon, somebody insured by Horizon, is very hard to predict. The risk, I think, is for those members who are part of what we call vulnerable populations, Medicaid, Medicare beneficiaries who get their plan through Horizon, people who don't have access to employer-based coverage. Those populations are served by Horizon in big ways now. And if the question is, one of the questions is, will they continue to provide that high level of service to those hard-to-serve populations?
There are many different subpopulations of consumers that get health care from Horizon. You can look at the employer market, people who are in the individual market that buy insurance themselves. You have patients who are involved in the federal Medicaid and Medicare programs. And so we think it's very important that you look carefully at the impacts on each customer segment, and you make appropriate adjustments that may be needed to ensure that those segments would be served well.
Right now, you know, we've got a recession or depression on. There'll be a lot of people losing their jobs. When you lose your job, you often lose your health insurance, because that's how a lot of us have health insurance. So there are going to be a lot of pressures, I think, from state government and other governments to look around for any available source of money and say, these are immediate needs. I think it's probably worth looking at the places where this actually has happened, and there are a number of states now where this has happened.
Sometimes when states are passing laws to authorize a conversion, they've designated who will sit on the board, and sometimes those positions are going to be appointed. And that is the case here in New Jersey, where they would be appointed by the governor and the legislative majority leaders.
Partly, New Jersey did learn some lessons from observing these transactions in other states, because as of 2001, we have a very strong law governing the conversion. There's still some gaps, and as I said, there's still lots of details and questions. And I think some of the lessons learned were by consumer advocates and others, that they have to be at the table and assert themselves for things to come out in ways that they'd like to see.
We do get concerned when the political sector intervenes and tries to run these foundations, as we've seen in New York. It's maybe a little bit less of a risk here in New Jersey because you have a specific law that creates the foundation board. But when there's $5 or $6 billion on the table in charitable assets, politicians will grab for that money. So we think people in New Jersey do have to be aware that this is independent, new source of money that's coming in, can be used to make improvements in the healthcare system, but don't let the government just take it and use it to replace its existing obligations to fund healthcare programs.
People's fears aren't necessarily good predictions about what's going to happen, okay? So I guess it's good to take the pulse of the public, but if you were to make your decision purely based on those subjective concerns and not try to counterbalance that with, well, wait a minute, did those kinds of things really happen? I think you would end up being too conservative in your decision about what to do.
The New Jersey law governing the conversion is a lot stronger than what we had in other states where things didn't go well. So we're off to a good start, but there's still a lot of discretion that the regulators have and the legislature ultimately will have in whether this will happen and what happens after it happens.
And there is a risk in all of this. I mean, there's always a risk of sort of over-regulation.
In the end, I think it's worth people asking the real hard question, what evidence is there, not just what are my fears, but what evidence is there from past places where this has happened, about whether this is a good thing, a bad thing, whether things have changed a lot or not. And I think part of what we heard today is that some of at least the worst fears that people have about major changes in taking Medicaid, major changes in premiums, major changes in rates of reimbursement for providers, although those are things that people fear, turn out not really to have happened in any of the places where these conversions have gone in the past. It doesn't mean it shouldn't be looked at, doesn't mean it shouldn't be studied as much as we can study, but it does mean you have some obligation to look at where this has happened before and try to judge, well, how likely is this, given that these fears have been expressed before and maybe really haven't turned out to be perhaps as big an issue as we might have feared they were.